I got some back pain. Give me some drugs.
Stop, Kathy. Don't do drugs.
How is somebody supposed to know the right thing to do for back pain? It's such a common problem.
Yes, and that's what this episode is all about. Today, we're going to talk about the worst things that you can do for lower back pain. And some of these things are really going to surprise you.
Mm-hmm. Spoiler alert. One is really common, and the other one, potentially deadly. You're going to want to listen to the end.
Oh my gosh, Kathy, this could be our most important episode ever. This is The Pitch. What happens when a chiropractor and a physical therapist get together to make a health and wellness podcast?
But chiropractors and physical therapists don't like each other.
Oh, think again.
I'm Dr. Kathy Lynch, physical therapist who likes to help people move and get stronger.
I'm Dr. Jason Young, an evidence-based chiropractor who uses humor just as much as adjustments to help people get better.
Welcome to the Pitch Podcast.
Remember, there's no I in pitch. We are back.
Hi.
Welcome back to the Pitch Podcast. I'm Dr. Jason Young.
Oh, and I'm Dr. Kathy Lynch. I forget that every time.
Every time. Yeah, we're going to have to start wearing name tags, I guess. But can we bring up that, like, today, instead of wearing a name tag, you've got your Notre Dame on.
Yeah, scorched earth today.
Oh, boy.
I'm bringing it.
All right. Hey, let's just check in on your mental health after the college football playoff news, and your team got snubbed, my team got snubbed.
Yeah.
Well, one of my teams. I'm an Oregon State guy.
Yeah.
We snubbed ourselves this season. But yeah, BYU, they got snubbed.
They got snubbed. How do you only lose to, what is Texas Tech, the number 4 team in the country?
Yeah,
Twice
both times they played them.
The only time, and you don't get in.
Yeah, I don't know.
Yeah, don't get me started on Miami or Alabama.
Yeah, well, and how are you in every week until the 1 week when it counts?
1 week, and we're like, just kidding, Notre
Dame. Yeah.
You're out. You beat Stanford 50-4.
But nobody cares.
No, and we're gonna knock you down.
Yeah, okay. It doesn't make sense. And you know what's funny is, like, sometimes people are like, oh my gosh, the Pitch Podcast, is that a sports podcast? And now we are.
It is.
That's all we're talking about.
That's all we're going to talk about today. How the college football playoff committee should be disbanded.
This doesn't match with our open at all, but I love it. I'm totally here for it. So well, let's talk about something a little more Pitch Podcast related before we jump into the stuff about the lower back. We want to talk a little bit about our stats because we got a surprise. Like, Christmas came early this year, I guess. You know how at the end of the year you get your Spotify, like, I think it's called a wrap up.
Yeah.
Right. And it tells you how many times, like, you listen to Taylor Swift.
Yeah.
Yeah. Right.
Oh.
Who's your most listened? Have you gotten yours yet? Are those out?
Mine is definitely Taylor Swift.
Is that your most listened to artist?
Mm-hmm.
Yeah, mine is different every year, and it's really weird. Like, one year there's like a country music person in there, and I don't listen to country, so somebody's been on my account. Yeah, ruining my stuff.
Who listens to country music in your house?
Everybody but me, literally.
Okay.
Yeah. So
can't pin it down then.
Yeah. One year was Desmond Decker, who most people don't know who that is, but just outstanding reggae.
Okay.
Yeah. So listen to Desmond Decker if you want.
Good to
but
know.
That's not what I want to talk about.
Okay. All right.
So when you podcast, apparently this is our first year with the podcast, but when you podcast on Spotify, apparently one of the things that they do is they send you a wrap up for the year. So we get to see, like, where we rank in podcasts. And I have to tell you, Kathy, I was blown away. Like, are you ready for this?
Yeah, I'm ready, please.
We are in the top 15% of video podcasts on Spotify.
In the whole world?
What? Yes. How did that happen?
I have no idea.
Like, we're talking like thousands and thousands and thousands of podcasts. We're in the top 15% of video podcasts.
Most popular.
Yes. Good job.
Wow.
Good job. Okay. You're
Crushing
special.
It.
Another thing too is they told us kind of where we ranked among new podcasts, podcasts that are new in 2025. If you just started listening to the Pitch Podcast, that's because everybody just started listening to the Pitch Podcast, right? Like, oh, I was listening to those guys last year.
Yeah,
no, you weren't. No. So we started in March. So without even a full year, with only like a 9-month resume, we are more commented on, we're more shared, and we're more listened to than 92 to 95% of other new podcasts. Yeah, this is history in the making.
Yes.
Yeah, we're killing it.
The pitches are here.
Yes, and this is so thanks, pitches, for showing up.
I mean, really, it's about them.
And this is when we announce that this is our last episode.
And we're out.
Not really, not
No,
really. In
no way.
fact, we have even more exciting updates. But
Yes.
wait, there's more. We are really close to launching premium subscriptions for the Pitch Podcast. So if you just can't get enough of this show, uh, we hear you, and we're going
Yes.
to give you more. And so there's going to be things like extra features. Like if you've been on like YouTube or Spotify today, you saw that we released a special episode
Yes.
with Chris Quokka, and it was kind of tangential to our mission here. It was about the health effects of giving and being generous.
It's the giving season.
Yeah, totally. And so extra features like that. Maybe you get a little behind the scenes look. Maybe you get some bloopers. Although, like, really, like on a show like this, could we have bloopers? We definitely do.
You see all the bloopers.
Right, right. We're gonna do some aggregations. So, like, we've talked a lot about things like squats or pain,
Yeah.
or different types of things, and we'll have full episodes where it's just like picking from, or we'll have full videos where it's just picking from each episode where we've talked about that topic. So you could watch a whole like video on menopause, and it's just going to be taken from all the little pieces we've had the show. And then also AMAs. Do you know what an AMA is?
Yeah.
Yeah. Ask me anything, right? And so our subscribers will have an opportunity to go ahead, put questions out there, and we'll just make a little baby episode just for you, answering your question.
Yeah.
And one of the things I'm most excited for is for probably our highest level of subscriber. We're going to give those people an opportunity to play some of our games.
Let's go.
Right? So the games are the fun part. If like you only watch the first 5 minutes of these videos, like you're totally missing out. Like the first 5 minutes sucks compared to the game. The game at the end, that's what you want to stick around for. So we're going to give subscribers an opportunity to call in, and we're gonna let you play a Pitch Podcast game, and there will be prizes and everything. So look for more information coming about how you can become a premium subscriber to the Pitch Podcast. And when we get premium subscribers, then like our families allow us to keep doing this.
They do. Please.
Yeah. So, all right. Should we get to the episode?
Yeah, let's have fun with this episode.
Okay.
You're one of the experts on back pain.
World expert.
World.
Yeah.
That's what I've heard.
World.
Do you have that sign outside the clinic?
Yeah, world expert, right? Usually, that's what my license plate is on all my vehicles. World Expert 1. It's like WRLDXPRT.
Yeah.
Yeah, I don't know.
No.
Yeah.
That doesn't fit.
I see a lot of people with back pain. Let's just put it that way.
You do. And we've come up with a list of 5 or 6 things.
Wait, I thought about it. We should do the disclaimer. We should do the disclaimer now.
Absolutely,
right.
Okay,
now, what's the disclaimer?
100%. The disclaimer is we are not giving medical advice. This is strictly entertainment only.
Not today. Not today. We're not giving medical advice.
Not today. Yeah. So do not talk to your doctor.
Talk to your doctor.
But we're going to get you some tips to talk to your doctor.
Yes. Especially if your doctor brings some of this stuff up, then you really need to talk to your doctor.
I think we're going to go least dangerous to most dangerous?
Yeah, it's going to be about like that. We have 2 at the end that are real doozies. One that's potentially deadly.
Yes.
And one that is very, very common and super unwise. Like all the evidence says, don't do that thing.
Do it.
Yes.
Yeah.
So
let's say, whatever they are.
Let's start with something that's like pretty common.
Yeah.
But
let's hear
also
it.
pretty basic.
Yeah. Acetaminophen, otherwise known as Tylenol.
Tylenol. Yeah, Tylenol is something that is great if you want autism. But I mean, I'm just telling you what the research says. But darn near useless for lower back pain.
That's a new peer-reviewed article I haven't read yet.
Yeah,
so you'll
right.
Have to fill me in.
Because it hasn't been written. That's why. So, yeah, Tylenol has been extensively studied as a treatment for lower back pain, and it's found to be, let's see, virtually useless.
Oh.
Yeah, and
Placebo?
if you get any results from Tylenol, it's probably placebo.
Okay.
Might as well go eat some ice cream.
Okay.
Yeah,
Ooh.
basically.
All right.
And so it's not a very useful intervention for lower back pain. And I think that one of the things really to bring up is when we talk about some of these things, there's kind of a couple categories for injuries, especially lower back pain. And that is acute back pain, which is like
not ugly.
Yeah, right. It's like, oh,
what a cute
this back pain is so cute, right? And then there is chronic lower back pain. So one of the nice things about Tylenol is it doesn't work for either.
Okay.
So,
Okay.
but um, but is Tylenol like? I think there's some people are like, oh, Tylenol is super safe, but is it safe? Like,
Mm,
are there risks with Tylenol?
yeah, I feel
Yeah.
like the liver doesn't love Tylenol.
The liver doesn't love it,
Yeah.
no.
Yeah.
It's actually in terms of over-the-counter drugs, it's the most commonly overdosed,
Oh,
over-the-counter drug
did
out
not know
there.
that.
Yes. Yes, just, right ahead of, I don't know, what, Zyrtec? No. No. I don't know if you can overdose on
Yeah,
Zyrtec,
yeah.
but
Sorry, Zyrtec, we don't know,
yeah.
but
I mean, if you're in Oregon, the Willamette Valley, you might feel like, you know,
yeah.
gargling Zyrtec, rubbing a little in your eyes and stuff like that, but no. But seriously, Tylenol, more hospitalizations for Tylenol overdose than any other over-the-counter
Mm,
drug.
mm,
So, yeah, your liver doesn't really love it.
no.
And so, if you wanna add a liver problem to a low back problem, by all means.
So why doesn't Tylenol work?
That's a good question, and I don't know that we really know the answer to it. It is so it's a pain medication. It's outside of the category. So there's different categories of like pain relievers.
Mhm,
So there's some pain relievers that they work on your brain to kind of
mhm,
turn off some of those
mhm,
sensations. There's non-steroidal anti-inflammatory
mhm.
drugs, which are just like they sound. So
Yeah,
they're not steroids,
right.
but they help with inflammation. And those function by kind of inhibiting an enzyme that then would cause pain and inflammation. Tylenol is not one of those. It's a pain reliever, and it just doesn't work
On
for
back pain.
lower back pain.
Yeah.
Yeah, it's a different type of problem. That's not to say that it isn't useful for other things. It's a really good like fever reducer,
Mhm.
for example. It's good for other kinds of pains. Like people can take Tylenol if they have a headache,
Mm,
but for lower back pain, just the research is not good.
mhm.
So
Don't do
skip
it.
it.
Yeah,
Skip it.
skip,
Yeah, yeah.
skip.
One of the worst interventions. It's generally safe except for all the autism, right? And I think if you take 3 of them, you're automatically autistic. Um, but also probably not true. Um,
Remember, this is
but
for entertainment purposes
yeah,
only.
only for entertainment purposes. But yeah, Tylenol generally safe, but it's like if you're trying to take more to get a bigger effect, it can end up hurting you more than it
Yep,
helps you. Yeah.
yep,
Hmm.
yep. Yeah. This is one of my favorites, this
Okay.
next one.
What's that?
Early imaging.
Early
Everybody
imaging.
wants an image.
They do.
Can I
Yeah.
get an MRI?
Yeah.
Can I can I get an X-ray?
Why do you need that MRI? Well,
Well,
because it hurts very bad.
I need to know.
Yeah.
I need to
Hmm.
know. I need to name it.
Yeah.
What's causing this pain?
So what's the problem with early imaging then?
Are you asking my opinion?
I'm asking I'm asking your opinion.
Okay, professionally.
Yes.
With early imaging, usually what we see in early imaging does not correspond with the symptoms.
Yes.
And in fact, I have had some recent patients who have gotten early imaging of their back, and recently this week, where they had what's called an anterior lolisthesis.
Great word.
Yeah, it's a good one.
Yeah.
It's a hard one to
It's a
say.
Scrabble winner.
Yeah, it's and it's really just not just, but the one vertebrae kind of slips in front of the other one.
Right.
Just you know, it was
Your
like
spine is literally misaligned,
yes,
right?
it's like 5 it was like 5 millimeters,
Uh-huh.
and the patient's like, "That's gotta be it. That's gotta be it."
That's what I'm feeling.
Yep,
That's it. I can
yeah,
feel it.
yep, and this pain just started, you know, 4 weeks ago.
Mhm.
Well, luckily or unluckily, she had had an X-ray in January.
Uh-huh.
So we went back and looked at that X-ray. Guess what?
It was still
It was
there?
there.
Okay.
Yeah.
Yeah.
So just because you have degenerative disc disease,
Mhm.
or an anterior lolisthesis or scoliosis does
Right.
not mean that is what's causing your back pain.
Preach.
Yeah.
Yeah, and it's a big deal. In fact, a lot of patients, they want imaging because they have pain, and
Mhm.
you cannot see pain
Yeah.
on an MRI, you can't see it on an X-ray, and you're right. A lot of these changes in the spine, they're good clues as to what might be leading to some of your problems, but it's a trap. Like a lot of doctors will do this where they'll go and they'll order early imaging, and they wanna find something that justifies, "Yeah, we were right to order this," and so they'll look at
Mhm.
something like that, and they'll be like, "Yep, see, there's your back pain,"
Yeah.
and it's totally wrong,
Right.
and, what's the harm in that? The harm in that is that some of those things you can't change, right? They're just
Mhm.
like, if you have bone spurs, like, you can go in and shave down bone spurs and things like, but it's super risky,
Mhm.
and, there's not much value in it too, because you get rid of those bone spurs, and guess what? You still have back pain. Well, what do you do now,
Yeah.
right?
You go back in?
Yeah, but yeah, we gotta shave them down harder this second time. So yeah, so early imaging is a real trap, and also, one of the things that's really important about it is that it changes the way that people think about their back.
Yes.
Yeah. So you see an ankylosis, you
Mhm.
see
Yep.
scoliosis, and, these words are expensive to learn, right? So, you see these things on there, and now it changes how you think about your back. "Oh, I've got a bad back.
Mhm.
Yeah,
Yes.
my spine is crumbling,"
Mhm.
right? And I think we've talked about this before, but even using words like degeneration,
Yeah.
degenerative disc disease, even any word that's, like, over 7 letters long,
Mhm.
it disables people.
Does.
Yeah, not meaning that, like, you get the handicap placard, but it changes the way that you think about the resiliency of your body, your ability to recover, and things like that. And, one of my favorite studies ever, I think I brought this up before, is they've taken healthy people that have
Oh,
no
yeah.
back pain,
Mhm.
they've done MRIs, and they have found that a significant number of these people have some of these changes, but they have no symptoms. So you can't really correlate everything that's found on imaging with your symptoms. And so looking at those early imaging things, they've actually done studies where they show that people who get imaging early have worse outcomes.
Yeah.
So
Yep.
don't walk into your doctor's office and say, "Give me that x-ray now. Give it to me now. Give me the MRI right now."
The MRI.
Yeah. So when should somebody get an MRI for lower back pain?
Usually for me, if they're having symptoms down into their legs,
Mhm.
pain past their knee,
Yeah.
and foot drop. When we
Yes.
see the muscles aren't
Muscle
where,
weakness, yeah.
yeah, muscle weakness, muscles aren't
Mhm.
working. We need that stat.
Right, they need the Depends,
Yes, great, good point.
right? They're having some
Yeah.
bowel or bladder
Yes.
incontinence.
Yes.
So yeah, so those are the things when you're having those
Mhm.
symptoms down the leg, down past the knee,
Mhm.
and not just the first sign of having them, well, with the exception of, like, maybe some of the muscle weakness and the
Yeah.
incontinence,
Yeah.
but, like, if you're having numbness or tingling, it's not an emergency to go out and get an MRI.
Right.
What you need to do is give it some time, treat it, do some active care, and see if those symptoms improve. If they don't or they become worse, then yeah, now
Mhm.
we're thinking about MRI.
Yeah.
The other thing is if there's a trauma, right?
Yeah.
So if you have
Yep.
fallen out of the third story window
Mhm.
and you landed on a ladder and then you fell into a pile of broken glass, yeah,
Mhm.
we're going to want
Yeah,
to do an
let's go
MRI.
MRI,
Yeah,
yeah.
you don't even need the glass. But yeah, if you have a significant trauma, an MRI might be a good idea. Or if we're suspecting some sort of a disease like
Mhm.
cancer, right?
Right.
So if you think that you have back pain because of cancer and your doctor agrees, then yeah, let's
Yep,
MRI
let's
it up,
let's
right?
go.
Yeah,
Yeah.
but otherwise, MRIs don't fix people.
No,
They don't.
they don't.
They did, they'd be giving them out
Yeah.
like candy.
If you
So
want a surgery, go get yourself an MRI.
yeah, one of the leading causes of surgery, right?
That's right.
So yes, very good. All right, what do you got next for me?
Okay. Ice, ice baby. Should I ice it or
Probably
not?
not,
Okay.
probably not. Yeah, so ice has become really controversial, right?
Mhm.
There's some people out there that are like, "Well, I learned in first aid that you're supposed to do rice," right? Rest, ice, compress, elevate.
Yes.
And actually, the person who came up with that acronym regrets ever having done it.
Really?
Yeah, because the research is not very good for ice.
Hmm.
So, ice is nice. Oh, geez. I
Oh
was trying
man.
to say something that didn't rhyme. Um, but ice is good from the standpoint of you can numb things.
Mhm.
It helps to reduce swelling and
Yeah.
helps to reduce pain and all those things.
Mhm.
And so you might be listening to me say that and being like, well, why is any of that bad?
Yeah.
Right. But the other thing that ice does is it slows down some metabolic healing processes and it can delay healing.
Mhm.
Whoops.
Yep.
Right. So, when you have lower back pain, in particular, if it's from some sort of like inflammation or something like that, your body is going to have an actual immune response to
Mm,
that pain stimulus.
mhm,
And if you're icing your back, then you are kind of blunting the body's immune response.
mhm.
And so, while it might feel good and give you some temporary relief, you're just prolonging the agony.
Just delaying it,
Yeah.
delaying getting better.
Yeah.
Seems like heat would feels better anyway.
I agree. I
Yeah,
hate icing stuff. Yeah.
it's the
It's like
worst.
it's like torture.
Yeah,
And I think that there's some exceptions,
yeah.
like cold baths are super popular right now. Like,
Mhm,
oh, I gotta do this
mhm.
cold plunge and everything. And those aren't really bad. But that's kind of a different
Yeah,
category thing because you're exposing your whole body to like some cold shock. And so
right.
there's some other reactions that happen. But like localized icing outside of like, I just had a burn
Mhm.
or I just had a sprain strain. And there's even some disagreement as to whether to do it then, but, in general, ice is like it's not as popular as it used to
It's
be.
not the cool kid anymore.
No,
Do you see where
I did that. Yeah, I did. That was good. Yeah, it's like, and, we talked about this before. If your gym teacher was trained in the '90s or your dad or your mom was an athlete in the
Yeah.
'80s, they're gonna be
Mhm,
like, "Yeah, you need to ice. You need
mhm.
to ice both of your knees."
Yeah,
Yeah.
I have to admit it's been hard for me not to tell people to
Yeah.
ice
Yeah,
because
'cause
that's
it's
just
classic.
yes!
Yeah, it's
Put some
like
ice on it, feel
yeah,
better.
it's like Steve Miller Band,
Yeah.
right? I don't know, like classic
Oh,
rock?
yeah,
No,
classic rock, yeah. I got you.
yeah. Sorry.
Did they use ice?
And now you guys have seen in real time what happens when your joke doesn't hit. Yeah. I froze her
You
as
did.
if with
What?
ice.
What did
All
Steve
right. So,
Miller
yeah,
do?
so throw out the ice pack. You don't need to be icing your back every night if you're having back
No.
problems.
No. Okay.
Next, hit me with it.
Number 4. Oh, this is solid. Docs really like to give this one
Oh,
out.
they love it. Yeah.
Muscle relaxers.
Muscle relaxers. Yeah. Muscle relaxers, first of all, basically they're sedatives.
Mhm.
So
Mhm.
there's that.
Here, this will put
Um,
you to sleep.
yeah. And when I have patients who are like, yeah, they gave me some muscle relaxers. Like, so should I be taking those on a regular basis? My first response is don't ask me about how to take medication because I don't prescribe.
Yep.
So it's outside of my scope of
Right.
practice to tell people I take their medication. And so
Right.
that being said, you should take your medication how your doctor tells you to take
Mhm.
the medication.
Mhm.
Now, that doesn't mean that you can't ask your doctor some informed questions about the wisdom of the medication that you're taking. And from what I understand about muscle relaxers, having read a ton of research on it,
Mhm.
is that one of the best ways to use them is to help you sleep,
Mhm.
right?
Yep.
From the standpoint of if you're sleeping and you're getting muscle spasms related to your back, then yeah, a muscle relaxer could be helpful for something like that. If you're using muscle relaxers to get through your day, you're going to be disappointed.
Yeah, that's not gonna be a good solution.
Yeah.
Yeah, and we don't wanna bag on physicians here.
No.
We're gonna do that in the next episode.
Yeah, that's the
Yeah.
next episode. Yeah, tune in next week. No, and
They're
she's
just
not even joking. Yeah, she told me the topic. She's like, "Hey, what if we do this?" And I was like, "I'm there for it.
we're
Yeah,
in.
I will actually be on time this week."
They're just trying to help, and
They are.
like, this is something that can help.
Mhm. Yeah.
Sometimes it does help people because
Yeah.
they just need to sleep.
Totally, right. And there is a placebo effect that comes with
Yes.
muscle
Yep.
relaxers,
Yep.
because people feel like, "Yes, I'm doing something. There's a button that
Mhm.
I can push," or something
Yes.
like that, and
Yeah.
so from that standpoint, good. Muscle relaxers do come with risks,
Yeah.
especially if you're going to be operating heavy equipment.
Yeah, don't do it.
So,
Don't do
yeah,
it.
by heavy equipment, a lot of times what we're talking about is something as simple as a car,
Yeah.
right?
Yeah.
So if you're taking muscle relaxers, it is not wise to go and drive.
Right.
You
Right.
could hurt yourself worse. You could hurt other people. It could cost somebody their life. Sometimes people have, allergies or reactions to muscle relaxers, which is another thing that doesn't really make them ideal. But to your point about like doctors giving them out, the reason they do it is because it's what they have
Yep.
available,
That's their
right?
tool.
I mean, what do you want to give them? Tylenol?
Yeah.
Are you crazy?
You've
You want
lost your
you wanna
mind.
give him Tylenol? No, I'm not gonna make another autism joke, though. No, so
We hit the limit on
nah,
that.
I did. Yeah, the sensors are like, "No, mm-mm." So, yeah, muscle relaxers tend not to be very successful, and I guess I should say with all of these things, somebody's probably listening there, be like, "Well, that's a lie. I took Tylenol and I got better,
Yeah,
mister." Or they might be like, "I iced my back and it was the only intervention that I needed." And I'm not saying that you're wrong. I don't doubt it. And it's just because everybody is a little bit different. Circumstances are a little bit different. If you have back pain that is related to one acute muscle spasm and taking a
yeah.
muscle relaxer ends that muscle spasm and it never comes back, guess what? You are cured. You're
Do it.
you're cured by that muscle
Mhm.
relaxer. But that is just not the case most times,
Right.
and not reliably enough that anybody should be like, yeah, if you have back pain, take a muscle relaxer,
Mhm.
especially not for chronic low back pain,
Right.
like almost worse than useless.
Mhm.
So,
Yeah. You can sleep.
okay,
Yeah.
are we getting to the dangerous
Here
one
we
now?
go.
Okay, this is the dangerous one.
Danger, danger. Again, this is not medical advice today.
But yeah,
Okay.
this is the deadly one,
The
yeah?
deadly one,
Okay.
opioids.
Opioids,
Mhm.
yes, yes. The fruit of the poppy. Yeah,
Yes.
so
Narcotics.
yeah, opioids, okay,
Yeah.
so opioids are like your Vicodin, your oxycodone, your OxyContin, your hydrocodone,
Mhm.
all those kinds of things. Those are opioids. And, um, in the early days of opioids, they were thought to be like the miracle drug
Sure.
because they were really effective in terms of helping people who had pain. Um, Most common things that we see them for now are after surgery
Mhm.
when somebody's going to be dealing with some really intense, serious pain. And so you might get a prescription for one of those things. But long ago in the 80s, 80s
In
and
our
90s,
childhood.
yeah, some of this is the fault of drug companies, but they were putting out opioids, massive advertising campaigns for
Mhm.
them, and they weren't disclosing that number 1, it was addictive, and number 2, they were deadly,
Yeah,
right?
deadly.
Yes, opioids and heroin are essentially the same thing.
Yeah.
They are hitting the same receptors in the brain, and so it becomes very easily a drug of abuse, especially if you get addicted. Now, there's some people who get hyper paranoid about opioids. They're
Yeah.
like, I don't even want them near me because I
Yeah.
don't want to become addicted.
Right.
It takes more than one
Yeah. It
in order
does.
in order to get you
It
addicted.
does.
But there are people who like you go for a surgery and you go through your course of opioids, and by the end of that course, you could have some dependence.
Absolutely.
Some people are more susceptible to it than others.
Mhm.
Now, back in the hey, this is a safe drug. There's
Yeah.
no danger with it.
The
Back
glory
in those
days
the
in the
glory
80s.
days, yes, the Mercedes 80s, right? Yeah, you could have your Quaaludes and your opioids.
They're handing them out like
Right.
candy.
Yeah.
Yeah.
Um, yeah, they would give them to everybody, right? They
Mhm.
give them to athletes. So
Mhm.
it's like, "Hey, go play your game," right? They gave a ton to veterans,
Yeah.
right? And it was,
Mhm.
not only, contributing to, uh, veteran deaths, they were contributing to addiction and homelessness and all these other kinds of things. So, opioids were just a disaster for a while. In fact, we call it the opioid crisis.
Yes.
Yeah, you Google that, and I'll tell you, it won't just be one web page that comes up. There's a lot.
Yeah.
And this is one of the areas where people can really get hurt if they have acute low back pain or chronic low back
Mhm.
pain and you're relying on opioids. There's almost zero evidence that it helps you to heal from a back injury.
Right.
And it is so dangerous from the standpoint of if you're on it for a long time, you risk losing your family, your house, your job, your
Right.
life, your sobriety, all those kinds
All
of
of it.
things.
Yeah. And you made a good point, and this kinda goes back also with Tylenol. This is one of those medicines that works on your brain. It
Yes.
doesn't actually get to the source of the pain. And so, it's just kind of altering
Yeah.
the neurotransmitters in your brain. So
Yeah.
it's not, like an Advil or an Aleve actually reduces inflammation. An
Mhm.
opioid does not do that.
Yeah.
And that's one of the big differences in why it doesn't, it's dangerous.
That's a good point, and, some of those brain changes can be permanent,
Mhm.
right? So
Mhm.
if you are too deep into opioids or use them too
Mhm.
often, you can be left with some permanent damage
Mhm.
from them. So, not saying that opioids don't have a place or
Right.
that they're not useful, but they must be used extremely cautiously. It has to be done under the supervision of your doctor. You should never use somebody else's
No.
opioids. I
No.
cringe every time somebody comes in. They're like, "Yeah, my back was really hurting, so my buddy gave me an oxy," and I'm
Yeah.
like, "Nah,
No.
geez,
Yeah.
did your buddy live under a bridge?" So he's about to. No.
Yikes.
But yeah, so you just gotta be really careful with this, and really, in terms of the risk reward, there's almost no reward for taking opioids for back
Mhm.
pain. They just don't really work
Right.
well to help you recover from a back injury or a back problem. So,
Yeah, I had my own experience with opioids. I had this just minor
uh-huh. Uh-huh.
surgery on my head,
Oh,
brain-ish
oh, that's it?
area.
Yeah,
Yeah, the
uh-huh.
minor.
Uh-huh.
And, they gave me Oxy, um, because they, cut my head open. And so after about 10 days or so, I noticed myself really looking forward to my next dose.
Okay.
And that's when I was like, hold on here.
Yeah.
Let's see if I can just not take this anymore. I didn't go cold
Mhm.
turkey because
Yeah.
that's the other thing. Don't go cold turkey.
Yes.
Right. But I
Yeah.
started to notice within myself, like, oh, this is giving me a boost. This is giving me a mood boost. This makes me
Yeah.
feel good.
Yeah.
And that's not the intent here.
Right. Right,
So
right.
I think I would be one of those people that's susceptible
Yeah.
to it. So
Yeah.
I
Well,
just,
and these days, like we said, you got to be working with your
yeah,
doctor on this. You were taking them because your doctor prescribed
yeah.
them. But sometimes people get used to that little boost. And then it's like,
Hmm.
okay, my doctor's not going to prescribe them anymore, but I can go get some at the local middle school.
Yeah.
Not in Corvallis. Not in Corvallis. Guys,
Philomath.
no.
Philomath.
Philomath. Okay, no, just kidding. But man, I know of 3 kids in our community
Oh,
who in the past couple years have died from opioid, use because they were laced with fentanyl,
oh
and
no.
fentanyl killed them.
Ah,
And so that's
yeah.
that's the other thing too, is that there's ways to get
Mhm.
opioids that aren't from your doctor, and
Mhm.
I just would not trust any of them. Like,
Yeah.
it's just not safe,
Yep.
especially now.
Yep.
So,
Yeah.
yes. Okay, we got dark there for a minute.
We did. We did. And
Yes.
let's come back to the light.
Okay, let's come back to the light. Maybe the most comfortable thing that we could possibly talk about, right?
Go towards the light,
Yes.
Jason.
And this is maybe, like, not the most deadly, but one of the most common mistakes
It
that people make.
is.
Yes.
It is. One or more dangerous ones too.
It can be, yeah.
Yeah.
Mhm.
Bed rest.
Bed rest. What?
Uh-huh.
What?
Yeah.
My comforter?
Yeah. Don't do it.
Yeah. My Serta mattress? It's ruining things for me? Okay.
Get to the gym.
Yeah, it's well, and
Okay.
it's
Maybe
and
not.
it's so common, like,
Yeah.
people come in all the
Yeah.
time, right?
Yeah.
And how do they inform you that they're on bed
This
rest?
is the first day I've been out of bed for 10
Yeah,
days.
gosh, yeah, I haven't been able to get out of bed.
Hmm.
Yeah, which unlikely. I mean,
Yeah.
there's people who legit can't get out
Yeah.
of bed, but, probably you just weren't really trying. Like, you're
Hmm.
like, Game of Thrones marathon, right? Oh, man, but, yeah, don't do bed rest
No.
if you have back pain, and I understand the impulse to
Yeah.
do it because it's like, "I need to be nice to my body, I need to
Hmm.
take it easy, I just need to let this heal up."
Yeah.
But for your back, nah,
Mm-mm.
that doesn't work.
No.
No.
Research says no.
Yeah, research says emphatically. Like, whenever I was going through and, like, kind of sharpening up all the information for these segments, there's some things where it's like, moderate level research says that this isn't that effective, and there's low level research that says this and that. Bed rest? Strong research, strong evidence.
Very strong.
Yeah. So this is gonna disappoint some people because they feel like, well, babying it's probably the way to
Yeah.
go, and if
Yeah.
I don't use it, then it's just bound to get
Yeah.
better. But that's not how backs work.
No.
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 So, how often do you think somebody is using their back during the day?
All the time.
all the time, like
Mhm.
literally all the time.
Literally.
If you are sitting in your car, you're using your back, right? So even
Mhm.
when you're sitting, you're
Sitting.
using your
Yeah.
back. Standing, running. The only time you're really not using your back is when you're lying down, when
Yes.
you're freaking lying
Yes.
down.
So that's why it's
Yeah.
feeling better.
Yeah. And when we start getting into what are some of the good things that you can do for your back, because we're not just talking about the worst, we're going to talk about some of the best. Like this is exactly the opposite. So don't do it, y'all. Get out of bed.
Get out of bed.
Like, do you remember that the Willy Wonka movie, right? Where
Yes. Yeah, yeah, yeah.
Charlie's
Grandpa.
grandparents were all
Yeah. Grandpa
sitting at the same
George and Grandpa
dude,
Joe.
yeah, Grandpa Joe. Oh, dude, I thought that was the grossest
Oh.
thing ever. It's like these old people all just
All four of them.
four people sitting in bed. It's like, uh, right. Oh my gosh. It's like, Charlie, why do you want to hang out with that guy?
All
He's
day
clearly got
long.
lower back pain. Let him just sit there and wallow in it. Oh, yeah, okay. I can't don't nobody go watch that
Okay.
show.
I
Yeah.
used to love that movie as a kid.
It was a great movie, but
Mhm.
I
That
I
part?
would not start watching until after that part because it grossed
It's
me out.
weird.
Yeah,
It's weird.
nasty. Oh,
It's
ugh.
weird.
Yeah. Ugh. Okay, anyway.
Alright, so what should we do
Okay, let's talk about this,
if we have back pain?
yeah, so let's start kinda where we left off.
Mhm.
If you have back pain, stay active,
Keep moving.
keep moving.
Yes.
"But my back hurts when I move." What do I do?
Bed rest.
It
Oh, no.
Not bed rest.
Oh, gentle,
Yeah,
gentle. Be gentle with yourself, but keep moving.
yeah, like, you don't have to go
Walk.
and, like, lift a boulder or something like
No.
that, but you should keep moving.
Yeah, walk,
Yeah,
stretch.
totally, and, there's something that I like to call active rest,
Yeah.
right?
Mhm.
So and I don't call it active rest because I coined the term. But, yeah, it's active rest is like, I'm still up and I'm doing things,
Right.
but I'm listening to my body,
Yeah.
and I'm not trying to, like, kill it, right?
Right.
So sometimes you'll have back pain, it's like, "Oh, I got out of this chair. Oh, man, that really, really hurts." But you don't know what's on the other side of that initial movement.
Mhm.
Once you get up and moving some, it might actually feel pretty good.
Sometimes it feels better, yeah.
Yeah, and oftentimes that's the fix.
Yeah.
So many of our muscles in our back, so many of the ones that cause back pain, they're postural muscles. So there's just like this is an oversimplification, but think about two types of muscle fibers in your body. You have fast twitch and you have slow twitch. The fast twitch muscles are the ones that you would use for like really intentional movements, like, oh, I'm gonna curl these weights or
Mhm.
whatever. I'm gonna wave at somebody. Those are fast twitch muscles, or I'm gonna go running, right? Slow twitch fibers are postural muscles, they're endurance muscles. And so many of the muscle fibers in your lower back they are those slow twitch postural,
Mhm.
um, muscle fibers. Now, those fast twitch fibers, they get their energy from glucose. So, you're getting your carbs or whatever, you're
Get your
eating your
sugar.
Nestle Crunch.
Yes, the
Yeah,
crunch.
not a sponsor, but
Maybe.
call me up, guys, right? So yeah, so that it's taking that sugar from your blood, from your muscles, and that's what's using to work. Slow twitch fibers, those use oxygen.
Mhm.
So how do you get oxygen in your body, especially to your muscles? You got to breathe, right?
Yeah.
And how do you get more breaths into your body? You got to work, right?
Mhm.
So if you're doing some aerobic exercise, like going for a walk, if you can do a walk, going for a bike ride, if you could do a bike ride. If you got lower back pain and you're having trouble bearing weight, see if you can go for a swim,
Mhm.
right?
Yep.
Just anything that you could do to keep moving, that's going to be helpful for those slow twitch
Mhm.
fibers.
I like walking in the water too,
Yeah.
aqua jogging.
Aqua jogging.
Yeah.
Aqua
Ah,
jogging.
get
Yeah.
your aqua jogger on.
Yeah, so, and really there's, like, kind of different categories of lower back pain, acute and chronic. There's different types of healthcare interventions for something like back pain or musculoskeletal pain. There are active interventions and there are passive interventions. So active interventions are when you're moving your body under control, doing things for yourself. Passive is when somebody does something to you. For example, a chiropractic adjustment. That's a passive intervention. I'm doing all the freaking work, people. Okay. So that is something where, you're laying there passively and we're performing, some sort of procedure or help for you. And then you go home and you do your exercises. That's the active care component. And both of them have value.
Yeah.
Active care is the solution though.
Right.
Passive care, the goal of that is to help you get into
Okay.
your active care.
Yes.
Yeah.
Yes.
So,
Yeah.
all right. So that's step one, stay active.
Mm-hmm.
Um,
Number two,
number two,
I would say if 5 to 10 days it's not feeling better or it's getting worse,
mhm.
that's when you call us.
Yeah, call us. Go,
Yeah, you don't have to see your physician either.
no.
Mhm.
And
Come to your favorite nard.
this is going to sound bad, but I don't recommend people go to their general
Right.
practitioner with back pain.
Right.
And that's not a knock on general
No.
practitioners,
No.
but I think a lot of general practitioners would tell you they'd rather not see back pain too,
Yes. They do
right?
not.
They want tummy aches.
Mhm.
They want to know like, hey, is it time for you to get your next vaccine?
Mhm.
Or, just any of those kinds of things.
Right.
They generally don't like back pain
No.
because they don't get a lot of training as to what to do with it.
Right.
A lot of times, if they're doing a really good job, what they're going to do is they're just going to refer you
Yeah.
to one of us.
Yes.
Yeah.
Yeah. So just call us director.
Yeah. And so that piece that you said though about like what if I have back pain, why wouldn't I just go straight to my physical therapist or straight to the chiropractor the
Mhm.
second that back pain showed up?
Mhm. Because usually it does, your back pain does resolve, research says, within 2
Hmm.
weeks.
Yeah. Yeah. So a lot of back pain
Yeah.
is just going to resolve on
Yeah.
its own. And so it's like, wow, are these people bad at business?
Yes,
Like,
we are.
do they not want clients? Like, trust me, there's enough back pain to go around. We don't need to get everybody the second you start
Back
feeling a
pain.
little bit terrible.
Yeah. Yeah.
I think maybe the exception, or I don't know, yeah, exception. I'll just go with
Okay.
exception to that is like if you have some history of something that
Mhm.
reoccurs and like you have some familiarity with like, oh yeah, this is that thing that happens to my back. I need to get it checked out. Then and you know that early intervention helps,
Yeah.
then that's fine.
Do it. Call us.
Right. But if you've never had back pain before and you're like, what is going on? Give it a few days.
Yeah.
Right. And
Yep.
if you feel better, awesome.
Yeah.
And if you don't, cool, come see us.
Mhm.
The other thing too, the other value in getting it checked out, a lot of people are just like, "Oh, I'm just gonna wait and see, wait and see, wait and see, wait and see, wait and
Yeah.
see," and like 6 months later,
Right. Right,
yeah,
right, right.
yeah,
Then they're limping around and their
yeah,
hips
totally,
hurt.
yeah, and now they
Yes.
have numbness in their leg and stuff
Yes.
like
Yeah,
that,
yeah, yeah, yeah,
and
yeah, yeah.
so, you don't wanna let it go forever just
Mm-mm.
because early intervention, while we're saying wait a little bit, early intervention on a more complicated
Mhm.
problem is gonna give us a lot more options
Right.
to help you out.
Yep.
I guess I would say the time that maybe you have back pain that you don't want to just wait and see is if it's also accompanied by a secondary symptom
Yeah.
like, "Oh, I've got back pain and I've got numbness in my leg,"
Mhm.
or "It's shooting down my leg,"
Mhm.
or "I've got back pain and I've got a fever."
Right.
Then if you have the fever, skip us.
Yeah.
Go to your general
Then you go to
practitioner.
your yeah. Night
Exactly.
pain,
Yes.
pain that doesn't change with position.
Right,
Yeah.
all those kinds of
Yeah.
things. So if it's accompanied by some other symptom, then yeah, you don't have to wait on that. But if it's just like, "Oh, I think I strained it a little bit," or "I
Mhm.
was mowing the lawn and it
Right.
doesn't feel so great," give it a couple days, and if it's
Mhm.
not fixed,
Yep.
Kathy and I will be happy to help
Yep.
you. So,
Yeah.
all right, what's next? Oh,
Oh.
we already kinda hinted at
Ooh,
this one.
yeah.
Heat.
Heat.
Yes,
Love the heat.
the heat is on. The heat is on.
Makes your nervous system less dramatic.
Yeah, it does. It
Takes the drama out.
chills those nerves out.
Yeah.
It does. And also, it basically does the opposite of the ice.
Yeah.
All the stuff that we're bagging on ice for.
Mhm.
It actually helps fuel that immune response. It decreases your pain, decreases muscle tension, increases blood flow.
Yeah.
Heat is really pretty nice.
Yeah. Yeah.
And I think one of the other things nice about it too is it's really accessible. So
Mhm.
you have access to heat like all
Yeah.
the time. A hot shower, a hot
Yes.
bath. Do
Yeah.
you ever have patients that are like, "Hey, would you write to the insurance company and see if I can get a prescription for a hot tub?"
Yeah, all the time. At least once a month.
Yeah. Yeah, and how does that go?
Um
"Yeah, hello, is this the insurance company? Insurance company, hey, I was wondering, like, could I get a hot tub?" And I'm like, "Hello, sir. Thank you for calling the insurance company. Yeah, let me just ask you a few questions before we do this. First of all, does your home have a bathroom? Yeah, it does. Okay. So thank you. Does your bathroom have like a bathtub? Yeah. Yeah, it does. Okay, great. Super. So is the hot water in your house hooked up to that bathtub? It sure is. Okay, then you have a hot tub, sir. Anything else I can do for?
Well,
Yeah.
it's gonna we don't even wanna give you PT visits. We're not gonna give you we're not gonna give you a whirlpool.
Right, right, right. Yeah, yeah. So, but all that is to say that
Yeah,
heat tends to be really good for
yeah.
if you have back pain. Just be careful not to burn yourself, like not too
Yes,
hot,
right.
and give yourself a break every now and then. You don't need to have the heat on 24/7. They got these little these wearable heat packs
Oh,
and stuff.
yeah.
Those are really good.
Mhm.
We have something in the office
Yeah,
called, oh geez, it's from Hyper Ice.
yeah,
It's the Venom
yeah, the
Go.
Venom, I have the Venom.
Yeah, so the Venom, they have the one that
Ah,
straps on,
yeah,
but the Venom Go, have you
yeah.
seen that?
That's the one
Love
I
it.
have.
Okay,
I
good, alright.
bought it from you.
Oh, you did? Oh, well, that's a great place to get it. No, but so it's like a
Yeah.
little sticky patch.
Uh-huh.
You put it on the spot that you want heated up, and it's got like a little magnetic control box,
It's amazing.
and it'll vibrate, and also it generates heat, and it's like
Oh,
Harry Potter magic, like
yes.
instant heat.
So good.
It's great,
Yeah.
yeah, so if you got, like, a hamstring strain or a
Mhm.
shoulder or, your back or something like that, come on down to Body of Health. No. No, or if you're nowhere near Corvallis, go on,
Yeah.
hyperice.com. They're not sponsors. I just like to point out everybody that isn't a
Is it
sponsor. Notre Dame also does not
not
sponsor us.
sponsoring?
No,
Maybe.
no, yeah, call them up.
Why not?
Yeah. So, alright, what about this last part?
Yeah, I love this last one.
Positivity and
Yeah,
reassurance.
mindset.
Yeah, but that's worthless, isn't it? Like, that doesn't help, does it? Does it really help?
It really does help.
Yeah, it totally does, right?
Yeah,
Well, I mean, have you ever had somebody come in who was just really freaked out by their injury?
yeah, yes,
Yeah,
all the time. The
yeah,
back is a scary thing for people.
yeah.
Yeah,
They're sure they're done.
yeah, this
This
is it.
is the calling card that says you're old. Now you're old, right? So yeah, how you think about it goes back to the imaging thing.
Yeah,
How you think about
mhm,
your back, how you think about your body, it really matters for your
yeah,
recovery. Um, a lot of times people get better. Well, interesting. You guys probably see this too, where people are like, "Hey, I need to get in to see you," and they get the appointment scheduled, and then they'll come and they'll tell you, "You know what? I started feeling better
mhm.
right after I called and scheduled."
Literally,
Yeah,
I hear that all the time.
yeah, totally, because it's like help is on the way,
Mhm.
and so your body starts letting go of some of that,
Relax, it's like, "Ah."
and then you come in, you do the exam, right,
Yeah,
or the assessment, and it's like, "Okay, hey, listen, this isn't a big deal. We're going to be able to help you with this," and they start feeling better then too.
yeah,
And so, the unknown is painful.
yeah.
And so
It's scary.
the more information they get, a positive
Mhm.
expectation. So if you have some lower back pain, get moving,
Of
get
course.
warmed up, and just have a good attitude about most of these things. They just fix themselves on their own.
Yeah,
If it's really serious, we're gonna tell you.
yeah, we will refer you out.
Yes,
Mhm.
yes, totally.
Yeah.
And the research, the things that there are the most research, most positive research for are active care
Mhm.
and also, this positive mindset.
Yeah,
Yeah, so encouragement, reassurance,
yeah.
those are the things with the 2 best evidence as standalone
Mm.
treatments, okay? Which I don't know why those 2 get to be bundled together and we call it a standalone treatment, but okay.
They're
Um
standing together alone.
yeah, and then there's the other things, like, people are probably amazed, like, "Why isn't he saying, like, go out and get an adjustment?" And stuff like that. Well, adjustments are helpful for
Sure.
back pain, but most of the things if you, like, were to go out and Google this or whatever, and you look at research, what you're gonna find is there's a ton of things out there where it says, "Yeah, this isn't very effective, this isn't very effective, this isn't very," and it's like, "What?" Even the active care and exercise, it says, "Not that effective."
No.
Back school, back education, not that effective.
Yeah.
So monotherapies
Mhm.
are not very effective for back pain.
Mm.
What is effective is combination or integrative approaches. So, like when you come and see me, yeah, we're going to give you a massage, an adjustment, whatever, but everybody's going to leave with exercises
Right.
because why would I just do one when I could do both and it's guaranteed to be more effective,
Right.
right?
Yeah.
And even like when people are like, oh, we get people who come in all the time and they're like, oh, I started feeling some back pain. So I started doing the exercises that I was doing last time. And, and they show up. And so those exercises didn't work on
Mm.
their own. Right. So sometimes that's the reality. A lot of
Right.
times people can just do the exercises and they
Yeah.
are fine.
Yeah.
But sometimes it's getting into a space where you can utilize multiple modes of care and it
Mhm.
ends up being really pretty effective.
Mhm.
So
Yeah. Gotta do them all.
yeah,
We made it.
we made it. Wait, we didn't quite make it because here's the exciting part. Are you ready to play a
Yeah, I
game?
am so ready for this.
Okay, it is game time. Okay, let me get to my list of game elements here. And Raul, we got the timer for this one. Okay, sweet. We got a timer. It's a 9-second timer, which
Timer.
what a strange timer, right? So here, if I can find it. There it is. Okay. So we're gonna play a game called let's call it the backs of life, like the facts of life, right? But the
Ah,
backs of life.
yes. Yeah,
Yeah.
yeah.
Okay.
Okay.
So I'm gonna give you 3 clues. And the answer is something that has to do with back. Like it's got the word back in it.
Okay.
Okay. You'll catch on pretty
Baby
quick.
got back.
That might be one of them. I don't
Okay.
know. I
All
don't
right.
know. Let's use that one as an example,
Okay.
okay? So I might say like rap, and then Raul starts the timer, and then after 3 seconds, you're
Oh,
gonna get another clue.
okay.
And then it might be
Mm.
like Sir Mix-a-Lot, and then and then the booty, right? And
Okay.
then it's like you're
All right.
trying to get the answer before
You
the
give me
time runs
all the
out. Yeah.
clues in the timer.
Yeah, you
Okay.
got it?
Got it.
Okay, ready?
We'll
All right.
see.
Here
We'll
comes the
see.
first one. You ready?
Mm-hmm.
Doc.
Tour.
Raul, there we go.
Chiropractor.
Biff.
Oh, Back to the Future.
Hey, very good. Good,
Hey.
good, good. Yeah, see? The other one would have been
Got it.
Marty.
Got it.
Okay, ready? Um, Here we go. Schoolboy.
Mm-mm.
Angus Young.
Oh,
AC/DC.
Back in Black.
Oh, just barely beat the timer. Very good. Okay, here we go. Ready?
Okay.
Nick Carter.
Oh, Backstreet Boys. Oh, I'm aging myself.
All right, here we go. Ready? Brutus.
Et tu, Brute?
Yes. Julius Caesar.
There's a back.
The Ides of March.
Romeo and Juliet.
Backstabbing.
Oh,
That's what we're looking for. Okay.
Okay.
Oh, let's see. Here we go. Oh, all right. Ready? Lakers.
Back to back to
Oh,
back.
very good. Very good. Back to back. Yeah, you also would have got Michael Jordan and the Warriors.
Yeah.
Oh, okay, here we go. Supply chain. Amazon Prime.
Back office deals.
3 to 5 weeks.
Back ordered.
Back ordered. Very good.
Oh.
Very good. Okay. Let's do 3 more. Okay.
Okay.
Okay, ready? 15. Permit. Mom. Backseat driver.
Oh,
Sorry.
gosh.
Those are the worst clues. All
That
right.
was okay.
All right.
Yeah.
Okay. How about this one? Country music.
Okay. I need one more.
Gravel.
Oh, gravel.
Chevy trucks.
Oh, back.
Back roads.
Oh,
Oh man, I want to send you out on a win. Okay, I want to send you on a win.
Darn
Here we
it.
go. Ready? Okay, here we go. Courage. Posture. Spine.
Strong back.
Backbone.
Oh, God.
All right, I got one more. All right,
We
ready?
gotta get this one.
Okay. Golf.
Backswing.
Oh, that's a good one though. Tennis. Ping pong.
Oh, backhand.
Oh, okay, I'll take that. That's good.
Okay.
I
What
was I
was
was
it?
looking for backspin.
Backspin.
Yeah,
Okay.
yeah. Very good. Okay.
Alright, I got a
Kathy, I
half
think
win
that
on
you
that
killed
one.
it.
Okay.
I think you got like a million points. Million points in that game. So let's wrap it
That
up.
was a
Take
good one.
homes. Take homes.
Take homes. Don't do drugs.
Don't do drugs,
Mhm.
Kathy. That's right
Opioids
back to
or
the very beginning.
Tylenol,
Yeah, it's rough. Like there's just not a lot of medication. NSAIDs.
unfortunately.
NSAIDs are pretty good
Yeah.
for lower back
Okay.
pain,
But
right?
ask your doctor first.
Ask your doctor and beware because,
Mhm.
too much is potentially dangerous for
Yeah.
other things.
Some people can't take
Yeah.
anti-inflammatories, so
Yes, but lay off the drugs,
yeah.
kids, right? For me, I think it's remembering that multimodal approach, right? We got to have several
Mm.
tools in our belt in order to effectively address back pain,
Mhm.
whether it's lower back, upper back, anything like that. Giving people the tools, not just to help. Like we love to help people when they come in, but people need to have tools when they're not spending 15 minutes or 45 minutes with us.
Right.
They need to be able to make it through the rest of their day.
Right.
And so teaching those things I think is just really important.
Mhm.
So, all right. Well, we did it.
That was great. That was a
Yeah.
good one.
Yeah. Hey, if you've hung out this long, just give up. Push the subscribe button. All right. Push the subscribe button. Listen,
Dave.
listen, you like us.
Yeah.
You really like
Yeah,
us.
you
We're kind of
really
in a relationship at this
I
point.
mean, you lasted almost an hour.
Yeah. I mean, you've probably listened to us more than you listen to your kids. If you're still here at this point, right? You probably listen to us more than you listen to your spouse.
No doubt.
Like our spouses aren't listening
No.
still. Yeah.
Nope.
So, yeah. So yeah, subscribe, share this episode with somebody, and keep an eye out for our premium subscriptions.
Yeah.
It's gonna be amazing. And so
Coming soon.
yeah, coming soon. So oh, and then there's that one important
One
thing that we got
thing.
to get to every single week.
Yep.
And that's
Yep.
that there's
No
no
I
I in
in
pitch.
pitch.